Hi, this is Zach with Alpine Rescue Team. This is Katie and Sabrina. Sabrina's going to be our patient. Katie's going to be helping me today. We're going to be doing a primary and secondary trauma assessment of a conscious patient. So we'll go ahead and get that started. To begin with, before I even approach the patient, we'll look around and assess for scene safety. I'm also going to put on BSI before I approach the patient. Consider gloves. Always put on gloves. Consider putting on eye protection as well, depending on the situation. I'm going to assess that I have one patient. And then I'm going to go ahead. Hi, how are you doing today?
Okay.
What happened today?
I fell.
Fell from where?
Up there.
Up here?
Yeah.
Okay. So I'm going to go ahead and assess it. That's enough of a potential injury for me to have someone take C-spine. Katie, could you take C-spine,
Is it okay
please?
if I help you?
Yes.
Okay. I'm just gonna hold your neck. I don't want you to move.
Okay, so now I'm talking to her. I can tell that she has an airway that's patent that she's protecting. I can look at her chest and see equal chest rise and fall. I'm going to go ahead and put her on oxygen. She's fallen. She has potential bleeding. Do that as quickly as possible. 4 to 6 liters via nasal cannula, or about 15 on non-rebreather, depending on how far you are from the trailhead and the severity of the injury. I'm going to take her pulse. She has a strong regular pulse. Her skin, pale, cool, clammy, diaphoretic. And so based on that, I'm going to make a decision that she is a high priority patient. Hi, what's your name?
Sabrina.
Sabrina, do you know where you are, Sabrina?
North table.
Do you know what happened?
Yeah. I was bouldering and I slipped.
Okay. Do you know what day it is?
Friday.
Okay. So she's awake, alert, and oriented ×4, answering questions appropriately. I'm going to go ahead and consider other resources that I may need. She's a high priority patient. I'd consider helicopter support if we're carrying her out. We're going to need more oxygen. We're going to need full body bean bag, litter, all that type of stuff to get a patient out of this situation. I'm going to go ahead and take a sample history. Sabrina, what's hurting today?
My leg.
Your leg? Which leg?
Right.
Okay, does anything else hurt?
No.
Okay. Do you have any allergies?
Yeah.
Okay, what allergies do you have?
Penicillin.
Okay. Are you on any medications?
Yeah.
What medications are you on?
Something for seizures.
For seizures? Okay. So you have seizures
Sometimes.
sometimes? Do you have any other medical history?
No.
No? Okay. When was the last time you ate?
This morning.
When was the last time you drank?
An hour ago.
Okay. Are you peeing and pooping okay?
Yeah.
Okay. Can you tell me a little bit about the events leading up to the accident?
I was just going up and I missed and went off and landed here.
Okay. When you're taking a sample history, make sure you write all this down so you don't have to think about what happened or what the patient told you. Also, when you're taking a medical history and you ask what medications they're on, if they're telling you that they're on a medication that you're not familiar with, make sure you ask what it's for so you understand how that's entering into the care you're giving the patient. Okay, so the sample history is done. I'm going to go ahead and move on to a secondary trauma assessment. So I'm going to go head to toe, touch everything on her body, see what all I can find. I'm going to start with her head and palpate her cervical spine. Okay. Palpate all her cranial bones, feeling for any type of decap, DTLS, any deformities. Look at her eyes. Pupils are equal, round, and reactive to light. Move under facial bones here. Don't feel anything there. Gonna look in her mouth. Nothing there to obstruct the airway, any bleeding coming out of the nose. Gonna look inside both of her ears here, look for any blood or clear fluid like cerebral spinal fluid as well. Gonna look at her neck here, any tracheal deviation or JVD. And then I'm going to go ahead and move on to her chest. Everything feels stable there. I'm going to palpate her abdomen. Did that hurt?
In the back.
In the back? Okay. If it hurts somewhere here, I'm going to palpate the other 3 quadrants before I go back to that, and then do the painful quadrant last. Okay? Move on and push your pelvis in like this. A lot of people train that you push in like this and then you push out. That's against Alpine Rescue Team policy and generally a bad idea because there's a lot of vasculature you can tear if you push in. You should be able to tell if a pelvis is fractured by pushing in like this. All you're going to do is damage if you push out, so there's no reason to do that either. And go ahead and feel along both of her arms. Feel for pulses in both hands together here. Okay, can you grab my hands? Okay, can you tell me which finger I'm first? Okay, can you tell me which finger I'm touching?
Third.
Third, okay. It was your right leg that was injured, right?
Yes.
Okay, so I'll go to that last. I'm going to do her left leg here. It's a good idea when you're doing it head to toe to look at your patient's eyes too. Sometimes they won't say something hurts, but you can see them grimace, and that'll help you find out things when someone's trying to be a tough guy. I'm going to check for a pedal pulse. Okay, check for those together. Can you push up on my hands? Okay, can you tell me which toe I'm touching?
First.
Can you tell me which toe I'm touching?
Last.
Okay, now I'm going to come down here.
Ah.
Ow, does that hurt?
Yeah.
Okay, I'm going to take trauma shears and cut this up and look at it. What I see is a bone sticking out in the open fractured tib fib. So that's something that we could go ahead and split when we get the chance to. This is going to be a high priority patient. I'm going to reassess vitals as often as I can. Typical high priority patient standards would be to assess every 5 minutes. That's not possible in the backcountry generally, but as often as you can, you want to assess vitals, especially if you're worried about this patient fell. It could be bleeding, whatnot. I'm going to go ahead and roll her over and check her back. Moving her leg here, I'm going to grab on either end of it. Fold it out like that. Hey, you give yourself a big hug.
We're gonna roll you on your side, okay? Okay, relax and let us do the work.
So whoever's holding C-spine is the one to run this. So Katie?
Going over on 3, are you ready?
1, yep.
1, 2, 3.
Okay. So I'm going to palpate down her spine here.
Ah.
Does that hurt?
Yeah.
Okay, so she has some tenderness to palpation here, mid-lumbar spine. And I continue moving down. Anything else? Make sure you check the lateral parts of her body too. Okay.
Ready to roll down?
Yep.
On 3, 1, 2, 3.
Okay. So now you finished secondary assessment. At this point, you're going to reassess things that you may need. If you think there's anything else you didn't tell initially after your primary, go ahead and tell whoever's on radio to communicate that down as well. Continue to assess vitals as often as possible and realize that this is a patient that could have some potentially life-threatening injuries, and this is definitely a high-priority patient you need to be paying attention to. And that's all.